right, so we've got a special conversation for you. I started out by talking about housing and homelessness, and it's been a little bit of the theme of the evening tonight. Next, we're going to hear about the work of our connection centres and the many partners that are involved in that across the region. We need to talk about housing first principles, which means trying to put people in housing first and continue those conversations in our community, absolutely. We need to think longer term, and we need to start undoing the generational harms that we have done to ourselves by not building affordable housing for 35 years, right? We have to do that, and we're on that journey. But there are still people right now who need our help, right? And we need to be there for them in their emergency, in their difficulty, right? Absolutely. A few years ago, we were talking about how things were getting worse, and then we kept talking. I'm looking at Catherine because we were in a million of those meetings, and we said we need to do something different because it isn't the same in our community. Housing and homelessness issues present themselves a little bit differently in a rural community than they do in larger centers. So we knew that was true, but we weren't sure exactly how to tackle this issue. And we knew that we had a challenge, one that is the massive geography that we face in our community. How do people access services across all of Huron and Perth? It's a very difficult challenge. Do you have more transportation? Maybe that's part of it. But we actually wanted to find ways to bring services to people, our most vulnerable citizens. And so in those conversations, the germ of an idea started to happen. And we saw what other people were doing in our communities. We could celebrate the work of organizations that had these ideas even before perhaps I did. And we could build upon them. And through those conversations, we developed what we think is a uniquely rural solution to the beginning of ending homelessness in our community. It isn't the whole answer. It's not the panacea, but it is doing something substantial. We want to make sure that we are moving people towards housing faster, right? And how do you do that? You have to build bridges. People who are vulnerable are not always ready to entertain the next institution in their lives, right? And so how do we build relationships? How do we do that with a place-based approach, we wondered. And we knew that if we worked together, we could make a difference, for sure, in the lives of many more people. So we knew this was kind of going on, and then COVID happened, right? Oh my gosh. Now we're dealing with twice as many people, literally, who were experiencing homelessness in our community over a short period of time. And it made us speed up and try to do some things quickly. And I'm so proud of our community for banding together. Here we have now 3 open connection centres across the region. We're about to open a 4th in about a month's time. And I hope that there will be a couple more. We're still working on this. But imagine all of our area serviced by connection centres, and you'll hear about what they are in a minute, helping the most vulnerable in our communities. Not only people who are facing and experiencing homelessness, but others who are living in deep poverty or need access to a service. This is an incredibly important and awe-inspiring effort that we have done collaboratively with many organizations and people across the region. So connection centres are the theme. There's a number of people that are going to come up and share about that. And by the end of the night, I think with me, you will know that we have made a huge difference already in many lives, and that there is more opportunity to do even more across the region with this amazing effort. So at this point in time, if you're involved in the presentation, please come on up. Okay? I was reminded to introduce them. Haha. Who are these fine people? All right. Of course, I know them well, but apparently you don't. All right, so with me, we have Andrea Lewhausen from the Northern Huron Connection Centre in Exeter. Andrea, amazing human being. Tandria Hefke from Stratford Connection Centre, right there. And Elise Metcalf, who's the Director of Housing and Congregate Care at CMHA, who helps to operate a couple of our connection centres. Not helps, they do operate. And then we have Gwyneth Woods from Hope Links, our North Perth Connection Centre, and we're so grateful that you're all here. So please let them explain some of the story.
Good evening. So as Ryan mentioned, I'm Gwyneth and I am from North Perth. And in implementing the North Perth program, I have had the pleasure of watching the program not only unfold, but more importantly, enfold community members in its welcome, in its care, and in its compassion. Each of us up here this evening were asked to share what we are seeing, hearing, and feeling within the walls of those connection centers. So you each want to know what impact is being made. So to begin this panel of examples, I'm going to tell you about Cheryl. No, of course, that's not her real name. But the story I'm going to tell you is true, and it holds a really special place in my heart. Like many of the individuals that you'll hear about this evening, Cheryl is local. Cheryl has family in our community, and there are community members who simply do not want Cheryl around. She's been met at doors of family members with weapons in hand and stern refusals from entry. And honestly, Cheryl can be difficult to love. She tends to lose simple things, her shoes, her coat, her phone, regardless of whether it's the heat of summer or the months of cold in the winter. Mental health issues are difficult for her daily. They make it difficult for her to sleep, and that leads to other things for her. Recently, she found the best solution for her was to just stay outside. She seemed to feel that it protected her and the struggles that she faced. For months after opening our doors in the Connection Centre, we would see Cheryl, a regular at our food bank, which is off-site, and we would encourage her to pop by. Never wanting to stay anywhere long, we'd try and seize the brief moments and encourage her to just go get a sandwich, use the showers, sit for a bit. But Cheryl, ever hesitant, worried aloud that she just didn't do good inside with people. It doesn't work, she would say, but we persisted. Now, a few months later, and multiple tentative steps, she's a regular. She showers on site 2 or 3 times a week and often leaves with a full belly and a sandwich for tomorrow. We could tell you stories of Cheryl allowing staff to administer eye drops from the stinging of the smoke outdoors. We can recount the times that she's accepted things like mittens or socks or blankets, exiting our space with phrases that sometimes seem unreal to our ears, things like, "Looks like I'll stay alive at least one more night." But the true beauty, the truly beautiful part of Cheryl's story can't be quantified. It's something much bigger. And it's something that spurs us on a daily basis. In talking about Cheryl one day with one of our frontline workers, they just lit up and smiled and said, "I just love Cheryl. She comes in and I just love her." And here's the best part. Cheryl knows that too. She feels loved. She knows that there's room for her there, space to grow and space to be. Her story isn't finished. This isn't a tale where her redemption has been found and her path is now sunshine. There will continue to be hurdles for her and many others just like her. But in our space, in our connection center, she will be encouraged. She'll be cared for, and most of all, she'll be loved. And to me, that embodies the kind of dignity and inclusiveness that we need to be striving for as we move forward each and every day.
Thank you, Gwyneth. I was first nervous to be up here. Now I can't see you, so that's helpful. For those in the room that don't know me, I'm Elise Metcalf. I'm with the newly integrated CMHA Huron Perth, formerly Choices for Change and Resilience. Had to plug that. We have a new name in the community. I was honored to get an email from the United Way to say, "Hey, would you be willing to host this section of the night?" I said, "Absolutely. Thank you so much." They said, "You have 5 minutes." Okay, anyone who in this room who knows me, 5 minutes is not enough time to talk about housing and homelessness and connection centers and frankly, the thing that gets me up every day. So inside a connection center, Again, we could be here all night. They're all individual. I think that's the important part to note, that what's happening in South Huron might not be what's exactly happening in Stratford and might not be exactly what's happening in North Huron, but the principles therein are the same. So what do? We do a lot of things, and again, can't capture it all, but meeting basic needs is a huge component to that. Our folks who are living rough or precariously housed often don't have their immediate needs readily available to be met. I think COVID showed us a lot of that with respect to like, hey, where's a public bathroom I can use when everything is closed? That is just one challenge that a number of our clients face on a daily basis. So those basic needs are something that we can address. As Gwyneth mentioned, come in for a shower, right? Laundry services. We hear a lot, and one of the kind of gurus around Housing First uses this analogy of like Uncle Larry in the room. You know, why don't those people just? And I think that's a really great place to start, because you don't have a place to go to the washroom. You don't have a place to utilize a shower, to write a resume, to build connection. It's really hard to just move forward with your life. The connection centers offer an opportunity for folks to meet those basic needs, to feel safe in a non-judgmental and non-biased environment, and build those bridges, as Ryan mentioned, out of their situation, or build those natural relationships with the staff and the volunteers. That is integral. A lot of our participants have had some pretty negative experiences over the years with service providers, and we strive to really break that down and meet them truly where they are, whether it's in the connection center, out down the street, in an encampment. Those are the places that we want to be and offer those supports for our individuals. Building social ties is a huge component of that as well. This is a community of people who are committed and passionate about a multitude of different charitable pieces that the United Way does. We want to create that environment for our participants as well. And as Gwyneth mentioned, right, feeling the love. A lot of us naturally have that in our day-to-day. Some of our participants don't. How do we fill that void? How do we fill that need? How do we build trust? That trust is a huge place to spring forward from. A connection, right, connection center, to existing social services. And I appreciate what Ryan said around, you know, it's a unique response to the very small communities that we have within Huron-Perth. You know, this is a geography the size of PEI. It's really hard to build things and say, you know what, go to the city of Stratford, go to the town of Goderich, you know, the big city centers within our community. That doesn't meet all of the folks in, you know, in Brunner or Milverton or some of these smaller communities. We need to go to them, right? The model that worked before doesn't work now. We have to shift, we have to be creative, and we've done just that. We have so many volunteers. We have a number of different service providers that come into our centers and, again, bring the services in to meet the folks where they are and they're most comfortable. And building pathways out of poverty, right, with providing dignity and choice. This is not our journey, right? It's a privilege to walk alongside the participants that we support. Excuse me. And our role is to empower them, right? There's been a lot of disenfranchised and disempowered individuals that we support, and we want to give them their voice back. And we have done that. And I think that's huge. For somebody to be able to walk out of our doors, feel that they have skills to advocate for themselves, and come back and tell us some awesome stories. That's what we thrive on. Now, I have 1 minute left based on this clock. I'm doing all right. Ryan mentioned Housing First. This is a best practice philosophy in Canada, the US, and a number of different European countries, and there's 5 principles to that. The first being permanent housing, right? Housing first. You know, get folks into a rental unit, into whatever housing looks like for them, with no readiness requirements and no barriers, right? So we're trying to push away those days of, you go through this checklist of 15 different things, and then we might think you're worthy enough for housing. No. Every single person that we support, every single person in this room fundamentally deserves housing as a basic human right. And that's how I get up every day, right? If I can make a difference, and our Connection Center team, these guys behind us, that's what they do. They embody these principles. Consumer choice and self-determination is another one. This isn't my journey, it's yours. How can I support walking alongside you through it? As I mentioned, housing supports are individualized. It needs to be recovery oriented, and that may be substance use or mental health recovery. It could also be trauma recovery. Homelessness is a state of being, but it's also pretty traumatic for any of us. And recognizing that, individuals have to have choice where they want to live, what their apartment looks like, who their supports are, what does their family look like, and giving that voice back to the folks that we support is integral to the work that we do. Harm reduction, right? Whether that's, again, from substance use or sex trafficking, those types of things, reducing the harm where we can, and that social and community integration. And I think the Connection Centres do a phenomenal job at that. Yeah, there's professionals, but there's natural relationships and friendships that are built, and having an opportunity to be innately involved in that is significant. Now, last but not least for me, is a thank you to everybody in this room that made that nearly $3 million possible. We are very fortunate to receive funding from the United Way. As Ryan mentioned, we have a 4th Connection Centre opening in North Huron, hopefully sometime at the end of April, pending electrical stuff. But I want to say thank you, because oftentimes when you donate to different charities, you don't always often see where your money goes. And the United Way does an incredible job at bringing that back to everybody in this room. So honestly, the need continues to grow. We know this. Housing is a crisis, not only in Stratford, not only in Perth County or Huron County. It's a crisis across this province. It's a crisis across this nation, and others. And we have to be creative to do the stuff that we're doing to meet the need, working upstream instead of downstream. And that's really all possible because of everybody in this room. So from the deepest pits of my soul, thank you. Thank you for seeing why we get up every day, and what we bring to the table to support individuals through their journey, whatever that might look like. Now, I'm going to flip it over to my colleague, Tanya. So Tanya was our coordinator at the Connection Centre. Through our integration, we've restructured a little bit. So she's actually one of our supervisors within our housing portfolio. But given that Tanya was very instrumental in getting things up and off the ground, I felt it was better for her to bring her experience. So Tanya's going to reflect on the Stratford Connection Centre, and I will pass it over to you.
So I'm going to share a couple of stories that have come out of the Connection Centre. I've been fortunate enough to be able to share many stories during many speeches and talks throughout my time with the Connection Centre, but there are 2 stories that I thought were important to bring forward tonight. And one really involves someone who is now, he's actually housed through one of our housing programs. And I thought it was a great example to show, start to finish, what housing actually means to people and how it can change the trajectory and course for someone's future. So this particular individual was involved in a fire, and actually our outreach worker, Kyle, who's here tonight, was able to support this individual while that was all happening, and other individuals that were involved. So it was sort of a tenfold. And then he came into the Connection Centre a couple days later. Of course, had no clothing. He was released from hospital with absolutely nothing. So we were able to support him that first initial day by providing him some gift cards so he could go purchase some clothing, get some basic necessities, that sort of thing. And for a couple of months, he was able to couch surf. He stayed with a couple of different friends on their couches, and then eventually that fell through, and he was no longer able to do that. And he ended up sleeping outdoors for quite a few months. Quite recently, I would say probably about 4 months ago, he entered into our ASH program, which is CMHA Huron Perth's Addiction Supportive Housing Program. I was really happy to speak with him this morning, and I found out that he's been 90 days sober. He is also just newly into a relationship. He said it's the first relationship that ever pursued him, so he was quite proud of himself. And next week he goes into a 19-day treatment facility. He's hoping he's on the list for a 60-day treatment. He's volunteering at 2 different local organizations, one being ours, CMHA here in Perth, and lots of really, really good things on the horizon for him. He's feeling incredibly positive. I tend to not you know, we have to set those professional boundaries. And so, you know, we try not to give hugs, but I walked in the door this morning at our peer support center, and he ran at me with arms wide open and with a big thank you for the support that we had been able to provide. I think more so than anything else, it's those relationships, right, that help to really push people through. Another participant who's actually housed, so he is permanently housed. He is a veteran that was involved in active combat, suffers from PTSD. He visits us every single day and has almost since the day we opened. He had to have some surgery, and so I think Kyle dropped him off. But I picked him up from the hospital, and I was going to drive him home. And he said, "Can I actually come to the Connection Centre so that I can recover with friends?" That part chokes me up. And I think that's really the important piece, again, is that, you know, we're supporting all different people. They're vulnerable in all different ways. But those connections that we can create with people, and we can get really, really, I guess, creative in what those supports might look like. And that particular individual that day, we pulled a recliner chair out into the main room from our quiet room, and yeah, he just recovered with friends, and I think he was king for the day. He had lots of attention we have one particular volunteer that is very motherly, and for our Connection Centre staff, they'll know exactly who I'm talking about, and she just doted on him all day long. I think he wanted to move in. So I think the most important piece in all of this is for us to understand that these are people, and they are people with they're somebody's mother, they're somebody's father, son, daughter. They're our neighbors, and they have real stories, and they're real people. And I've just been able to be part of something. It's really magnificent. I had no idea when we first opened what it would be. I remember the first participant walking through the door, and I thought, okay, somebody came. And then another person came, and then another person came. And I just asked Sarah, because I'm not there every day anymore, I just asked Sarah, and we're at well over 300 people that have accessed, unique individuals that have accessed supports at the Stratford Connection Centre. So that's big. So that's it. Thank you.
Thank you, Tanya. I mentioned earlier that the Connection Centres, although have a similar logo, we operate a little bit differently, and that's important because you can't have a cookie cutter approach to meeting the needs of diverse people in a multitude of diverse communities. So the next person that's going to come up and give us a bit of a welcome to the South Huron Connection Centre is Andrea Lewhausen. So Andrea has a couple of stories to share about her time in Exeter.
So I'm going to share with you 3 different stories from some individuals that we have been taking care of at the Connection Centre. So the first individual, his name is Todd, and he was a client who came to us last year. Todd just kind of showed up one day looking to help, and he fit in with our volunteers really well. Over the course of the first month, it was like he had been there forever. Him and I began to build a relationship, and through our conversations, I discovered that he had been living in his car for the past 2 months. He had lost his job, and he was unable to see his children, and he was feeling extremely overwhelmed. We had our service providers coming, and they were becoming familiar faces. I convinced him to go see one of our workers with me, and by setting him up with services, she was able to get him started working on benefits, updating his license, and get him on the by name list. Over the course of 6 months of working with Todd, we were able to provide a space where he was able to come daily to shower, to do his laundry, and have a meal. But he also was able to build a sense of community within the Connection Centre. And in February, we were all ecstatic and celebrated together to find out that he had been accepted into Turning Point. Since then, Todd still stops in to see us and to volunteer. He is now looking for a job, and he's been able to have visits with his children. This story I'm extremely excited to share because the person who this is about gave me permission to share it. And his life, what he said to me was that his life was completely changed because he found the Connection Centre. And he doesn't know where he would be without that. And he is just one of the many clients that we've had in the Connection Centre that has shared that with us. And the next story that I have is about a single mom. And this one I've shared a lot of times, and every time it still makes me cry. So I'm sorry. But we had a single mom that was coming to access our food hampers that we have available. And one day, her and I sat down to have lunch together, and she began to share with me her story. She shared that between having to use the laundromat and trying to buy milk and bread, that she would have to alternate weeks. So one week she would do her laundry, and then the next week she would buy milk and bread. With the services that we had available at the Connection Centre, we were able to offer her a space to do her laundry, and then we got to send her home with milk and bread. This freed up money for her to use in other areas of her life. It was able to make sure that she was able to stay in the housing that she was currently in. But more importantly, she has become a treasured volunteer for us. She has made friends with other members of the Connection Centre, and she has formed extremely important connections that is helping her thrive within our community. And my last story is about a client named Tyler, who we have been supporting for over 3 years. Tyler came to see me at the Connection Centre with one of his friends. Both of these individuals are homeless, and his friend recently had come back into our community. Tyler came into the Connection Centre calling my name over and over and over again. I came out of our hall and approached them, and Tyler introduced me to his friend by saying, "This is my best friend, Andrea, and just tell her what you need and she will help you." Sometimes I think we have a measure of success with the Connection Centre that is based on how many individuals we have housed. And housing an individual is always going to be our first priority and the most important thing that we will do. But I also think that our success is measured by having a space that I know that our clients know that they can come to, that they have someone that they can trust, a place that they take ownership of. Tyler is not housed yet, but he has a place that he can come and shower, where he can sit on a couch and watch some television, a place where he can coordinate his appointments with his support workers, and he has a place that might not look what we would consider a home, but he does. Thank you.
You're broken down and tired of living life on a merry-go-round, and you can't find the fighter, but I see it in you, and we're gonna work it out and move mountains. We can work it out and move mountains. And I'll rise up, I'll rise like the day, I'll rise up, I'll rise unafraid, I'll rise up, and I'll do it 1,000 times again. And I'll rise up, high like the waves, I'll rise up, in spite of the ache, I'll rise up, and I'll do it 1,000 times again. For you, for you, for you. When the silence isn't quiet, and it feels like it's getting harder to breathe, and I know you feel like dying, but I promise you we're gonna take the world at its feet and move mountains. We can walk it out and move mountains. and I'll rise up. I'll rise like the day. I'll rise up. I'll rise unafraid. I'll rise up, and I'll do it 1,000 times again. And I'll rise up high like the waves. I'll rise up in spite of the ache. I'll rise up, and I'll do it 1,000 times again. For you, for you, for you. All we need is hope. And for that we have each other. We have each other. We will rise, we will rise, we will rise. And I'll rise up, high like the waves. I'll rise up, in spite of the ache. I'll rise up, and I'll do it 1,000 times again. For you.